Hey everyone, it's Dr. Donna Hamilton. I'm CEO and Chief Wellbeing Officer for Manifest Excellence. At Manifest Excellence, we help CEOs create happy, healthy, productive work families that make it easier for employees to do the job they're hired to do. Our strategy sessions, courses, coaching, and consulting help decrease stress, improve mindsets, increase productivity and performance. To schedule a capability briefing with us to learn more about what we do and how we use holistic and trauma-informed strategies to do it, go to manifestexcellence.com. That's manifestexcellence.com. I wanted to hop on quickly and give you an update about what I've been doing. I just spoke at a phenomenal conference and I spoke about trauma-informed leadership. And I wanted to come on and just share a little bit about it because a lot of people are not familiar with the concept of trauma-informed anything, let alone trauma-informed leadership skills. Now, did you know that 2/3 of adults experience at least one adverse childhood experience, also known as trauma, and that adult survivors of chronic toxic stress are much more likely to have changes in their brain that really shift the way they experience the world and the way they interact with other people? And did you know that how team members at work interact is much more important and stringent predictor of their success than actually the skill sets of the people on the team? And did you know that 50%, that's half of the workforce, has left at least one job in order to get away from their manager so that they could improve their own quality of life and well-being? That's a lot, right? But in spite of that, can you imagine what it would be like to have an approach and a strategy to still increase the performance and productivity of your workforce? Well, that's what trauma-informed leadership skills can do if you adopt this. Now, what is trauma-informed? Being trauma-informed or having a trauma-informed approach is really about a perspective and a mindset that approaches people and situations, understanding how pervasive trauma and psychological trauma we're talking about is within society. As we mentioned, 2/3 of adults have experienced at least one significant trauma in their childhood. So then if you add on what we would say regular or common traumas of adulthood, like car accidents or fires or unexpectedly losing a loved one, having surgery. There's so many types of traumas. An overwhelming majority of adults are walking around with psychological scars or psychological, which is what a trauma is. Literally, the word trauma means a scar. So they're having an experience that affects the way they or could affect the way they interface with the world. That includes coworkers. And many people are not aware of that. So when you have a trauma-informed culture and a trauma-informed approach, we use what in medicine we call universal precautions approach. So in medicine, when you're dealing with blood or other body fluids, we use universal precautions. And that means that you assume, until proven otherwise, that there's like HIV or hepatitis or something that you don't want. And you interact with that specimen accordingly. When you use a trauma-informed approach, because we know how pervasive traumas are, you interact with people with the presumption that they have experienced a trauma and that may be altering or shaping the way they interact with you. And you proceed accordingly. So it's the same concept. So it's not about excusing or dismissing away anything. It's really about increasing your emotional intelligence and the way you approach interactions with people so that you can be more effective and more likely, therefore, to move forward in a constructive way. Right? For example, empathy. Empathy, believe it or not, is the single most important determinant of a manager and how they will affect their team members' performance. And then there's other things that are important too, but when it comes down to it, people perform better when they know they're working with and for someone who understands them, right? So when you have a trauma-informed approach, it helps you do this. So even when there's a situation that you have to deal with or a behavior that you have to address, when you approach it with a trauma-informed lens, it makes it easier to do it in a way that is effective and that the person you're interacting with can receive the feedback that you are giving them. Right? So it's really a new way of looking at things and a way of approaching. So for example, if someone is just acting up and acting out at work, right? You know what I mean by that. Typically people will think some version of what is wrong with them. When you have a trauma-informed work culture and people approach it with a trauma-informed perspective, they don't necessarily, their first thought isn't what's wrong with them. What happens to them, right? And so you approach the situation from a different perspective, and it makes it easier to come up with solutions that affect change. Now, we can go on and share a lot more information because it's important to understand what being trauma-informed is not, as well as it is to understand what it is. And so I gave a whole talk, and I'm not going to go into that. But rest assured, having a trauma-informed approach does not mean excusing bad behavior, right? Or it doesn't mean that everyone is going to become a therapist and listen to everyone's problems. That's not what it's about. It is, however, about understanding that people, whether they realize it or not, are bringing past experiences with them. And remember, 2/3 of adults have experienced something in childhood, and depending on how chronic that trauma was and the type of support they had, they may actually have changes in their brain that really affect how they process and interact with people. All of this, many people are not aware of. That's why it's so important to understand how to approach everything from a trauma-informed perspective. And there are specific principles to do, so it's not just an awareness. There's some very specific principles to use and then apply. And most of these principles, when you learn them, they actually are principles that are just good leadership skills. But sadly, and many of you know this, that leadership training is lacking in a lot of workplaces. Many people select their managers based on their technical skills, which is important, but they don't actually pick managers based on their ability to lead and to manage, right? So many times they're lacking these essential skills that are so important for actually getting work done, for being able to lead teams, to be able to resolve conflicts, to be able to motivate and inspire, to be able to have conversations in a way that is inspires your people to move forward and motivates them to move forward rather than being authoritarian, right? So this is another tool that people can have in their toolkit to help their managers be effective. Because remember, I mentioned earlier, a study done of high-performing teams found that how people interact with each other is a much bigger predictor of their performance than their skill sets, right? And also, the same study found that psychological safety is one of the top indicators or factors in how people interact. So it's all related. I could go on and on. You see, I'm very excited about this. I'm going to stop here. If you're interested in learning more about trauma-informed leadership skills, what it means and how it can help your teams and your workplace improve productivity, and improve retention, improve recruitment of top talent, go to manifestexcellence.com and schedule an appointment with us. We can come in and we can give you some information. We can schedule a capability briefing, or we can, if you're not ready for that, you can still contact us and we will send you some information so that you can become familiar with this. I'm going to go back to this phenomenal conference, and I'll catch up with you later. Be well.